I've performed over 1,000 rhinoplasties in the past 10 years, and this is what most patients want to know. I'm Dr. Angela Sturm. I'm a facial plastic surgeon. So most patients want to know, does it hurt? How's the recovery? What am I going to look like? And I'm not going to look like Michael Jackson. And the answer is you're definitely not going to look like Michael Jackson. In general, the recovery for rhinoplasty is easier than what most people expect. They're concerned, it's surgery. They're concerned about, is it going to be painful? Am I going to look crazy? When am I going to be able to go back to work? How am I going to be able to carve out time to do this? And how much time does that need to be? For the pain aspect, most people take 8 pain pills or less. We did a study over a bunch of different rhinoplasty patients over different practices, and it's less than that, which equates to about 2 to 3 days of needing pain medications. And then Tylenol is fine. And this is the vast majority of people. There's a bell curve for everything. And so some people need more, some people need less. But in general, it's kind of discomfort. Better than most people expect. How much time do you need to carve out? I tell people usually about 10 days. The way that I do it, I have a splint on your nose for 5 days and then tape for another 5 days. And after that tape is off, then you can go back to work, go back to your normal social activities. And whenever I think about recovery, I think about the recovery, like physical recovery and then social recovery. So the physical recovery, the first 3 days, don't plan on doing anything. You're not going to get anything done. Just sleep and rest. After that, you're going to feel better, get up and around, be able to do stuff around the house, be able to work on the computer, maybe work from home. You're going to be able to do those things, but you may have some bruising and swelling around your eyes. You're going to have a splint on, so you're still going to be in that social recovery phase. And after that day 10, where we take the tape off, most people, a lot of the swelling is down, the bruising is gone, or it's easy to cover with makeup or put some glasses on and don't really notice it. So that you're through like the social recovery phase. The total recovery phase is longer because the swelling takes about a year to go down. But after that first 10 days, other people don't really notice that you've had anything done. You notice it, it's your face, you know exactly what it should look like. And the people that know you and are close to you and know that you've had it done, they watch that process too of the swelling going down and things getting more refined and thinner. I always tell people that first month, you'll see the swelling go down from top to bottom, so around the top of the nose. And then between month 3 and 6, you'll see it go down around the tip. So just to, for planning purposes, if you're having pictures, wedding, things like that, give yourself at least that amount of time and a full year for everything. What is it going to look like? I think it's very, very important to have a detailed conversation with your surgeon of what you think a good nose looks like, because good nose can mean almost anything, and so if we go into the OR and I have this idea of what it should look like and you have this idea, even though if I do this, you're not going to be very happy with that. And so that's why I use computer imaging to draw on it. It's kind of like a Photoshop program, and we can draw different options and make sure that we're on the same page of what we want this to look like. Because I take those pictures into surgery, I tape them up onto the wall, I look at them, I look at you, I make sure we're as close as I can humanly get it. And we get pretty close because I have an idea of what I think I can do with your nose by looking at it. So I can look at it, I can draw something, and I always try to draw something that I know that I can achieve. And if you want it a little bit thinner, a little bit smaller, we'll go for that. Having that conversation, saying, I know that I can get it here. If you're happy with it here, let's move forward. But I know if you want a little bit more, I'll go for it. But most people, we say, this is the bullseye. This is what we like. I know that we can do this or do very close to this. This is life. Nothing's 100%. No one can guarantee anything, but we can give you a pretty good idea with relative confidence of what we think it would look like. I like to know if you like certain noses, what about those noses that you like. If you say, oh, I like this actor's nose or this one's nose, or you have a bunch of different pictures of noses on people's Instagrams, what about them is it do you like? Do you like that the tip is softer and rounder? Do you like that they have a little scoop? What are the aspects of it that we can incorporate into your nose and your face and to make you look good, that we can use those? Obviously, you're not that person, and so what looks good on them may or may not look good on you, but we can use aspects of it even if they do look different from you. And how do you know it's not gonna look crazy. That's the concern. That's people's big concern, because there's tons of people walking around that have had their nose done that you have no idea. But the ones that you do know they've had their nose done, that's what people don't want. They don't want to see into your nostrils too much. They don't want to have that ski slope. How do you ensure that's not how you end up? I think it's clear communication with your surgeon of exactly what you want, seeing lots of their pictures of noses that they've done and seeing their aesthetic, because we all really do have a sort of aesthetic. We will tailor each nose to each person, but we do have things that we like, and we like the way that looks. And so I like a very natural look. I like it to look like you. I'm going to be more conservative. That is who I am and what I like. And so I want you to see a lot of different pictures of noses that I've done and make sure that you like the things that I like, and that we're on the same page, and we can say, okay, this is our goal picture that I feel comfortable I can achieve. Because the people that I've seen that are coming in for revisions, it either wasn't clear from the beginning exactly what the outcome was going to be. There weren't pictures, there weren't a clear discussion. It was kind of a, oh, by the way, sometimes, which rhinoplasty should never be an oh, by the way. You should never go in for, oh, I want a breast augmentation, and oh, we can do your nose too. Don't do that, because a nose is not an oh, by the way. This is the main character. It's the middle of your face. This needs to be the star of the show. So it was that situation of, oh yeah, we can do that at the same time. Yeah, no problem. And they could, depending on the surgeon, maybe you could do it at the same time and they would be amazing at both, but it does need to be a main character. Or it was done a long time ago. Our techniques have changed. We are much better in creating natural noses that last over time. 30, 40 years ago, the techniques were not quite as good, and maybe they looked really good on the table, and maybe they looked really good for a year or two, but 10 years down the line, the way the inks have changed and aged and shift and things like that, it may not look great. And so now we're thinking more about the structure and about durability of looking good and natural. Those are the things that people have asked when they've come in. So let me know if you have other questions, and we'll make more videos. Or if you want more personalized attention and questions answered, come in for a consult at www.drangela.sturm.com.